Thank you so much for having me. I would like to begin by acknowledging the traditional owners of the land where QUT now stands. I'm presenting on the topic of the Pact for the Future and Global Public Health. The Pact for the Future by the UN General Assembly is a very important development. It is a statement of international solidarity and international cooperation, which is great. If we look at the background of the Pact for the Future, it was the COVID scenario where the idea of the Pact for the Future originated. It was in September 2020 that member states, they requested the UN Secretary General to come up with recommendations to address the present and future challenges. And in response to that call, the UN Secretary General, he came up with the Our Common Agenda, which called for the Summit of the Future. And the idea that originated in September 2020 in the wake of COVID-19, it finally culminated into the Pact for the Future in September 2024. So COVID was the trigger behind this idea. But if we look at the Pact for the Future, it is surprising and shocking to see that health is not one of the 5 major themes. And there is no mention of pandemics and epidemics in the Pact for the Future. The entire document has no mention of pandemics. So it is surprising because it triggered, the idea was originated from the pandemic, where the international collaboration and cooperation and multilateralism was collapsing, and there were issues in terms of self-interest, nationalistic approaches that the Pact for the Future is aimed to address. Now, my presentation is divided into 4 parts. In the first part, I will be looking at the public health dimensions of the Pact for the Future. What are the different actions in the Pact for the Future that talk about health? And then in part 2, I will specifically focus on Action 34B of the Pact, which deals specifically with the health, and it calls for achieving universal health coverage, and it calls for addressing the challenges that are faced by the developing countries. Then third part of my presentation will talk about the proposed pandemic treaty, which is a related theme, because the idea for pandemic treaty also originated from the experiences that we had during the COVID crisis. Then I will briefly talk about the role of the World Health Organization in boosting health priorities of the Pact for the Future. And I will focus on the financing or funding mechanisms at the WHO. So let's start with the public health dimensions of the Pact. There is a mention of health in Action 2A, 5B, 8F, 10B, 11, 21D, and 29A. All these actions, they mention health along with other things like education, social protection, decent work, and other things. So there's no elaboration on how they are going to deal with health in these actions. So just mention of health. Then Action 34B is specifically focused on health. I will come to Action 34B in part 2 of my presentation. Then Objective 3 in the Global Digital Compact says, we commit by 2030 to create a safe and secure online space for all users that ensures their mental health and well-being by defining and adopting common standards, guidelines, and industry actions that are in compliance with international law, promote safe civic spaces, and address content on digital platforms that causes harm to individuals. Then commitment number 23 in the Declaration on Future Generations says, protect the right to the enjoyment of the highest attainable standard of physical and mental health through universal health coverage and strengthened and resilient health systems, as well as equitable access to safe, affordable, effective, and quality medicines, vaccines, therapeutics, and other health products to ensure healthy lives and promote well-being for present and future generations. Now, if we look at the wording of this commitment, you will see that there is nothing new. We see the similar wording in the existing international human rights treaties. We see the similar wording in our SDGs, SDG 3, that is related to health. So there is nothing groundbreaking in relation to health. If we look at the Pact for the Future, there are some groundbreaking aspects of the Pact for the Future in some aspects, like the idea of reforming international financial architecture is something new on the table. We didn't have these ideas before. But in terms of health, there's nothing groundbreaking, except that Action 4 talks about closing the gap in financing SDGs and including SDG 3, but that Action 4 in terms of closing gap, financing gap in achieving SDGs is a general action. It's not specifically related to health. So again, the health has been dealt with in a very general and vague manner. There is no mention of any specific diseases that we are trying to address. There is no specific challenges that have been mentioned in the Pact. So generally, the UN is very good in setting objectives, but here, unfortunately, we haven't been good in at least setting the objectives that we are trying to achieve. And if the objectives are not set clearly, we are not going to gain much traction in achieving those objectives. Then Action 34B says, accelerate efforts to achieve universal health coverage to ensure that all young people enjoy the highest attainable standard of physical and mental health, including immunizations and vaccinations and sexual and reproductive health, and address all challenges faced by developing countries in achieving these goals. Now, if we look at universal health coverage, again, it's not a new idea, it's not a new theme. It has been there in the existing instruments. Leave no one behind has been a key message of the United Nations General Assembly's resolutions adopted in 2012, 2015, 2017. So universal health coverage is a key theme in those UN General Assembly resolutions. The United Nations Sustainable Development Agenda 2030 has the very same vision. The Sustainable Development Goal SDG 3 focuses on promoting health and well-being for all. So again, universal health coverage. Target 3B states support the research and development of vaccines and medicines, provide access to affordable essential medicines and vaccines for all. Again, universal health coverage is covered in these provisions or in these goals. So it's a recommitment to existing commitments. Then if we look at challenges faced by developing countries, we cannot cover all the challenges in a 20-minute presentation, so I'm not going to look at all the challenges. I have looked at some of the challenges that developing countries face in terms of intellectual property, international intellectual property framework, but it will be too much to talk about all those issues. So I will focus on the issue of socioeconomic disparities. And if we look at the issue of access to medicines and vaccines and access to healthcare that I have been working on for last 10 years of my life, that is a small component of universal health coverage. It's not the health as a whole. Even if we include access to like doctors and medical attention, that is still a small component of health. It's not the whole scope of health. If we look at the WHO Director General's comment, he says, health is not created in clinics and hospitals. It is created in streets, homes, communities, schools, markets, workplaces, and parliaments. It is created in the air people breathe, the food they eat, the water they drink, the conditions in which they live and work, and in our changing climate. So if there are social determinants of health, it depends on your socio-economic condition. So your health depends on the social condition that you are living in. And there are economic and social disparities between rich and poor that have been, it has been a long-standing real-world issue. The UN Secretary General said, inequality defines our time. More than 70% of the world's people are living with rising income and wealth inequality. The 26 richest people in the world hold as much wealth as half of the global population. So it's a real world issue. And I personally think we won't be able to eliminate these disparities. We can reduce them. Our policies should be aimed at reducing these disparities, but we won't be able to achieve an ideal world where there is no inequality. What we can achieve is the goal of universal health coverage. Like, people who need medical attention, they should not be pressured and they should not be burdened with the pressure of paying from their own pocket. In many countries, we do not have a system like Medicare. People have to pay from their own pocket, and it adds to their financial burden of basic health care. So we can achieve that goal, that nobody has to pay for health from their own pocket. We need financial commitments, binding, concrete financial commitments from all countries, and the global health should be a global concern. It should be a global initiative. We cannot expect from nation states to take care of their health needs because they are financially constrained. I will come to those financial constraints in part 4 of my presentation. But it is an achievable goal to invest in health. Yep. Now I will turn my attention to the proposed pandemic treaty, which is a related concept, because the idea for pandemic treaty also originated during the COVID crisis when the multilateralism was failing, and there were nationalistic approaches that were highlighted during the pandemic. And the pandemic treaty is dealing with a number of issues, like there were costly delays in implementing appropriate countermeasures. There were failures in ensuring adequate global supplies and equitable distribution of key commodities. There were failures in coordinating with others and combating systematic disinformation. So there are a lot of issues that the pandemic treaty is trying to address, but I will focus on only a few of the provisions of the draft treaty that are more related to my area of research. So the background to the proposed pandemic treaty is that in November 2020 at the Paris Peace Forum, the European Council President floated the idea of an international pandemic treaty. On December 1, 2021, the WHO agreed to launch a negotiation of the proposed pandemic treaty. The WHO is authorized to establish legally binding conventions under Article 19, but WHO has rarely exercised this constitutional authority under Article 19. In more than 70 years, there has been only one binding treaty that WHO has negotiated, that is the Framework Convention on Tobacco Control under Article 19 of the WHO Constitution. And the process of negotiating a treaty is inherently slow. The previous convention that was negotiated at the WHO, it took 8 years. And the current proposed the pandemic treaty negotiation is also going very slow. I will come to the barriers in a moment. Now, what areas should be covered in the pandemic treaty, or what areas the draft treaty is looking at? An automatic waiver of TRIPS provisions. It is not on the draft treaty, but from my experience of research in this area, there should be a provision for automatic TRIPS waiver provisions. We have 2 examples of TRIPS waiver since 1995. The first TRIPS waiver was in relation to HIV/AIDS, and the second TRIPS waiver is is in relation to COVID-19. And if you look at the timelines, you will see there are significant delays in negotiating these waivers. And if these things are happening, if these delays are happening during a pandemic, you can imagine the suffering and loss resulting from these delays. So there must be a provision for automatic waiver of TRIPS provisions. Let's look at some of the provisions that are in the draft treaty. Article 9 of the draft treaty deals with R&D. There are 5 paragraphs and several brackets in Article 9. There are a number of soft promises to cooperate, but no specific obligations to fund anything. Then Article 10 of the draft treaty deals with the issue of diversified local production. There are 3 paragraphs with no brackets. There is no mention of intellectual property, which poses formidable barriers to diversified local production, because if the patentee corporations, they are not willing to license their technologies, we cannot support local or diversified production. Then transfer of technology. Article 11 of the draft treaty deals with the issue of transfer of technology and know-how. It is one of the most challenging provision to conclude. It has 51 brackets, and if a draft provision has this much number of brackets, it shows that there are issues in inserting mutually agreed terms. Then it was expected that the pandemic treaty would be signed off at the May 2024 World Health Assembly, but that deadline was not realistic and it couldn't be achieved. Still, there is not much progress in negotiations. There are outstanding issues that need consensus, and financing is one of the most contentious issues, because for preparedness, prevention of future pandemics, you need a pandemic fund. So every country has to set aside a certain amount of money. How much each country is paying, what are the terms and conditions, these are critical issues. Now when it comes to WHO, there are gaps in funding. The current funding for WHO is around $3 billion, and to achieve the goal of the vision of universal health coverage as envisioned in the Pact for the Future and Sustainable Development Goals, the WHO needs tens of billions of dollars every year. Not 3 billion is not enough, because even if the poor countries, they have action plans, national action plans, and they want to transform their health systems, they need financing from external sources. They don't have sources at the national level. So there is a need for funding breakthrough for WHO. And Action 4 of the Pact focuses on inclusiveness of international tax cooperation and calls for a UN Framework Convention on International Tax Cooperation. So it's a new idea, and it can be helpful in dealing with that issue of funding gap that WHO currently has. So when health is at risk, everything is at risk. This is the key lesson that we learned from our experience with COVID-19. Health and sustainable development are mutually reinforcing and interconnected themes, because health intersects with many SDGs. We need to specifically deal with global public health issues and focus on finding credible and sustainable solutions to address the long-standing issues. To mitigate a future pandemic, we will need a widely dispersed manufacturing capacities that can be achieved in a regulatory environment which facilitates technology transfer, access to regulatory data, and trade secrets. The pandemic treaty should address these issues. Thank you so much.